I'd like to introduce our next speaker, Dr. Theoni Patterson, who is an assistant professor in the Department of Psychology at the University of Victoria, where she supervises students within the clinical psychology graduate program and heads the behavioral research on aging and illness in neuropsychology brain lab. She's a visiting researcher at Baycrest Health Sciences Center in Toronto, an affiliated investigator at the Vancouver Coastal Health Research Institute, an affiliated researcher at the Fraser Health, and a registered psychologist in both BC and Ontario, with practice in neuropsychology. Theoni is also the current chair of the clinical neuropsychology section of the Canadian Psychological Association, and further, she is a local site principal investigator for the UVic site of the Canadian Longitudinal Study on Aging, and a co-investigator on current funding for this study. Dr. Peterson's research interests include improving understanding of the interplay between neurocognition and psychosocial functioning and predicting real-world health outcomes in aging and illness groups. Aims of this work are to translate basic research to clinical settings through design and implementation of screening measures with utility in diverse groups, and to develop psychological and cognitive programs aimed at improving real-world health outcomes. Her current project include development and testing of a short psychoeducational e-health intervention to support cognitive health, the assessment of potential shorter and longer-term cognition and psychosocial difficulties post-COVID-19, the examination of potential contribution of executive function abilities to vaccine confidence among youth. So without further ado, I'd like to introduce Theoni for this presentation.
Thank you. I'm just going to try to share my slides and hope it works well. Let's see. Okay, so does everybody see that advance? Yes. Yeah. Oh, all right. A thumbs up. Awesome. Okay. Yeah, thanks so much. And as you've already heard, I'm here to talk a little bit about the CLSA. And yeah, so let's just get started. So for anyone who's unfamiliar with the CLSA, just a little bit of kind of history into how it came about and when it all got started. In 2001, the Canadian Institute for Health Research and its associated Institute on Aging issued a request for applications to develop a protocol for a new initiative that they were calling the Canadian Longitudinal Study on Aging. And a research team headed by Doctors Susan Kirkland of Dalhousie, Parminder Raina of McMaster, and Christina Wolfson of McGill submitted a joint application, and they were awarded the funding to develop the proposal for that study. A feasibility phase was started in 2004 to about 2006. And then in 2008, the CLSA team was successful with an infrastructure application to the Canadian Foundation for Innovation to establish the infrastructure to carry out the national study. In collaboration with Statistics Canada, the CLSA launched recruitment of its first 20,000 participants for the telephone interview portion of the study in 2009. In 2010, 4 computer-assisted telephone interview sites were opened. And then ethics review was completed for the 11 ethics boards across Canada for the in-person assessment centers, the data collection sites or DCSs. And a pilot study to assess the feasibility of in-home interviewing portion of the study was held in Montreal and in Hamilton in 2011. In 2011 and 12, the CLSA had its first group of participants for pilot study at the data collection sites for the in-person at McMaster University. And then in 2011, they launched their next cycle of recruitment for telephone interview. So the first portion was through the Statistics Canada, and the second portion was in partnership with provincial ministries of health and also using random digit dialing, which I'll get a bit more into later. And then recruitment of the 30,000 participants who are taking part in at-home interviews and data collection site visits began in early 2012. And so, in short, the CLSA, or the Canadian Longitudinal Study on Aging, is a large, comprehensive research platform and infrastructure program for aging research in Canada. It collects longitudinal data for more than 50,000 individuals between the ages of 45 and 85 at baseline. and the span of the study is at least 20 years until 2033, if not potentially longer. The main aim of the CLSA is to understand why some people age healthily and others do not, and discover ways to help us live long and live well for longer as well. So in terms of timeline, this is just a little bit of a visual. In 2015, the CLSA completed recruitment for its baseline on 51,388 participants. At baseline, 21,241 participants were enrolled in the tracking or the telephone interview cohort, and 30,097 participants in the comprehensive or the in-person cohort. And the CLSA participants are followed every 3 years. Follow-up 1 was completed in 2018, and follow-up 2 completed in 2021. And then data is currently being collected for follow-up 3 between about 2021 and 2024. Since the first data release in 2015, more than 400 research teams in Canada and around the world have accessed the CLSA research platform. The CLSA has also mounted several sub-studies and related projects, which I'll touch on a little bit more later, but briefly, there are 3 studies that explore impacts of COVID-19 and the pandemic experience. And then there's a CLSA memory study and the Healthy Brains, Healthy Aging initiative, which is just getting started. So what makes the CLSA unique? In Canada, we have, and in many other areas, we have an aging population. 20% of our population, but a little bit over 20% of our population is over the age of 65, with an estimated that by between 2050 and 2060, over a quarter of the population will be over 65. So aging research is incredibly relevant to the Canadian population and other populations. And CLSA is in a unique position to provide a large amount of data to support Canadian aging research specifically. With respect to design, the CLSA is unique in its broad coverage of multiple disciplines in the aging population, from biological to medical, psychosocial, cognitive, social, and lifestyle and socioeconomic aspects of aging. In addition to questionnaire and physical examination data, the CLSA does also collect biospecimens and for biomarker research from about 30,000 of its participants every 3 years. And there's also genomics data at baseline as well for a large component of the sample. The CLSA team is also currently working to establish data linkage capabilities between participant data and healthcare utilization, disease registries, and mortality databases in the provinces through Health Data Research Network, or HDRN Canada, to also allow for provincial data access in conjunction with CLSA participant data in those in different provinces. So that's underway and hopefully will be available soon. In terms of kind of CLSA, how it breaks down the governance of it, the CLSA is a strategic initiative of CIHR, the Canadian Institutes of Health Research. Support for the CLSA has been provided through CIHR and the Canadian Foundation for Innovation primarily, as well as provincial governments in BC, Alberta, Manitoba, Ontario, Quebec, Nova Scotia, and Newfoundland and Labrador. On the right, you can see, or hopefully you're right, I think, you can see the organizational chart for CLSA governance. There's oversight by CIHR that liaises with the scientific management team, which acts as the principal decision-making body for the study. The Scientific Advisory Board is composed of leading researchers in aging and health, and that multidisciplinary board provides advice and direction on succession planning, the science, managing technology change, and data storage and use mandates for the CLSA. The Advisory Council provides overall guidance and advice to the scientific management team on policy and promotional aspects of the study. The Data Sample and Access Committee, which will be important to anybody interested in data, is responsible for review of applications for access to and use of data or biological samples. The Operations Committee is the primary scientific and study implementation board, and its mandate is development, operation, and maintenance of the CLSA infrastructure and equipment central to the day-to-day operations. There's a training research capacity committee that's responsible for advising the operations committee on education, research capacity, and mentorship in relation to the objectives of the study. There's also a knowledge translation and communications committee. And then there's the working groups, which play an important role in the creation of scientific content for the study and in promoting the CLSA in the scientific and policy communities. The CLSA infrastructure includes state-of-the-art facilities, including as I mentioned earlier, the computer-assisted telephone interview centers, or CATI sites, that are responsible for data collection for the 20,000 plus telephone interview study participants. And these are located at Simon Fraser University, University of Manitoba, Sherbrooke, and Dalhousie. And then there's the data collection sites, or DCS sites, which are responsible for the other approximately 30,000 participants who complete the in-home and DCS visits for each wave of data collection. And those are located in 11 cities across Canada, including Victoria. There's also biorepository and bioanalysis laboratories, a statistical analysis center, a genetic and epigenetic center, and then the National Coordinating Center, and data curation centers, both in McMaster, where data is stored. The CLSA utilizes innovative open source software for its multi-center research, novel hardware design and architecture with data collection computing specifically designed for the study, secure data management systems to preserve confidentiality, and as I mentioned, is working towards collaboration and harmonization with other national cohorts or studies, data as well in the provinces. So the aim with the CLSA is that the knowledge gained through this data collection will change the way that we live and approach healthy aging. The ultimate goal is to improve the lives of Canadians as well as others around the world. Some of the anticipated impacts include identifying ways to prevent disease associated with aging, improving health services for our aging population, gaining understanding of the impact of non-medical factors, so for example, economic prosperity and social change on people as they age, answering questions to inform health policy and government programs and services, generating knowledge on the interrelation of biological, clinical, psychosocial, and societal factors that influence disease, health, and well-being, and developing Canadian research capacity and training of future generations of researchers who can use this data and the infrastructure as well to explore other areas of aging research. And while the core CLSA team publishes some team papers, data are continuously being made available for request and use by researchers in Canada and abroad to support these aims. So a little bit about the data itself. So the CLSA consists of a national stratified random sample of over 50,000 Canadian women and men aged 45 to 85 years at the time of recruitment. Participants were selected randomly for inclusion. The inclusion of study participants as young as 45 years of age was done to capture middle life experiences prospectively, because important changes are known to influence outcomes later in life that begin during that period. That lower age limit also permitted inclusion of a sample of a baby boomer cohort, so those born between 1946 and 64. And the upper limit was meant to include not only those in their senior years and making the transition to retirement or recently retired, but also those who had already reached old age, with one of the initial interests in studying the old age group prospectively, specifically to examine transitions into the final years of life. With the breadth and size of the sample, there is a lot of data in the CLSA, and linkage to the health administration databases that's being sought currently is going to add substantively to the potential research questions that the CLSA can speak to, but it can already speak to a lot. Digging just a little bit further into the sample for those interested in recruitment strategy or how the sample is formed. In terms of strategy, the CLSA initially used the Statistics Canada Canadian Community Health Survey, or CCHS, on healthy aging as its enrollment platform for the tracking cohort, so the telephone interview folks. The use of provincial healthcare registration databases was also came into play as a second source for both the tracking and then also the comprehensive cohort. And then as a third source of data, recruitment or participant recruitment, they used random digit dialing as kind of backup for both cohorts. As a little bit of background into the Statistics Canada CCHS, this was a cross-section, well, it was set up by Statistics Canada to produce cross-sectional estimates of health determinants, health status, and health systems utilization for health regions and provinces. And it comprised 2 cross-sectional surveys that were conducted over 2-year repeating cycles. In the first year of each cycle, the sample was very large, about 130,000 participants, with the goal of informing at a regional level. In the second year of each cycle, data were collected to provide estimates at a provincial level, and the sample size was about 30,000. So the CLSA used cycle 4.2, which was a second year smaller cycle, so about 30,000 people of this healthy aging survey, to draw their sample from. And they did that specifically because that version of the survey had been developed collaboratively with the CLSA research team and focused on factors that impacted healthy aging, such as general health and well-being, physical activity, use of healthcare services, social participation, as well as work and retirement transitions. And so the target population of the CCHS Healthy Aging Survey was originally 55 and over, living in private dwellings in the 10 Canadian provinces using the 2006 census. As part of the CLSA collaboration, Statistics Canada recruited an additional sample starting at 45 for that cycle of the survey. And so that was used for the tracking sample. To supplement that, as I mentioned, the provincial healthcare registration databases were used to, and the reason those were used were to allow comparison of respondents to non-respondents on key demographic variables. Those databases were also used for the comprehensive cohort. However, because each province has a unique set of data requirements, it wasn't possible to use the health registration databases for recruitment in all provinces in the time frame that was required. And so that's where the random digit dialing came in. It was random digit dialing to landlines specifically, which nowadays would not be so cool. But back then, given the Statistics Canada 2010 reported cell phone usage, only about 5% of people would have not been included by that sampling frame due to exclusive cell phone use. So in that time period, it was not too much of an issue to rely only on landlines. In terms of sample representation, inclusion and exclusion, there's no oversampling for any regions or special populations in the CLSA. Residents of the 3 territories and some remote regions, persons living on federal First Nations reserves and other First Nations settlements in the provinces, full-time members of the Canadian Armed Forces, and individuals living in institutions were excluded at baseline. So this was individuals covered specifically through the Statistics Canada and in individual residences specifically. So that included people in long-term care institutions not being included or being excluded at baseline. Individuals in households and transitional housing arrangements. So for instance, a senior's residence in which there's minimal care provided, individuals have their own phone lines, their own, units, that kind of thing. Those people could have been included at baseline. Individuals unable to respond in either English or French were also excluded. And the presence of a chronic medical condition at baseline was not a reason for exclusion. However, anyone with a cognitive impairment specifically at baseline was excluded. So the baseline sample was a cognitively healthy sample. To participate in the comprehensive cohort as well, individuals needed to agree to in-home interviews and going for data collection site visits to have collection of anthropometric, neuropsychological, and physical measures at the GCS site. So in terms of the data collection, as mentioned, we had about 51,000 participants. Of that, 21,000 were phone interview participants and about 30,000, just over 30,000 at in-home interview and data collection site visits. Just in terms of what each type of participant expected or was kind of getting themselves into. For the tracking cohort, the telephone interviews were approximately, for each round are approximately 60 minutes. And occur every 3 years, as mentioned. For the comprehensive cohort, the face-to-face in-home interviews are meant to take about 60 minutes. As well, the data collection site visits take approximately 2 to 3 hours, depending on the participant. And again, those are every 3 years. So for the different participant types, in addition to interview questions and some short cognitive tasks that are completed by both groups, the comprehensive cohort participants complete more cognitive testing as well as physical assessments and have blood and urine samples collected. This is just a figure from the CLSA site that visually shows how the two cohorts move through data collection periods. In 2013, both cohorts also completed a 30-minute maintaining contact questionnaire interview by phone with additional health-related questions. Participants also, so they undergo their repeated waves every 3 years with anticipated until 2033. You can also see the sub-studies that have started to crop up as well recently underway in this figure, and I'll come back to those in a couple minutes. In terms of the types of data collected, briefly, the CLSA collects data across domains of relevance to health and aging, including demographics, social, physical, clinical, psychological, economic, and healthcare utilization. At each follow-up, the same core data is collected as a baseline with some tweaking of measures at each wave, and often some additional questions or measures may be added at subsequent data collection waves, although as minimal as possible to keep the burden for participants down. For the comprehensive cohort, physical assessments include weight, height, hip and waist circumference, pulse and blood pressure, ECG and CIMT tests, spirometry, DEXA scanning, hearing and visual, as well as glaucoma and testing and retinal scanning, a timed 4-meter walk, get up and go, balance and coordination, grip strength testing, things along those lines. And then biospecimens are taken, blood and urine. And questionnaires are administered to both of the cohorts, including sociodemographic and lifestyle questions, self-reported physical health, current medications, questionnaires to assess psychological and social health, and labor force questions. And then cognition is also assessed in both cohorts, although a little bit more in depth in the comprehensive cohort. And these next couple slides are just a few tables from the CLSA protocol that outline data collection for the two samples. So this one shows how different physical health aspects are measured in the two cohorts. So for the comprehensive cohort, there is a physical exam and questionnaire items. And for the tracking cohort, a subset of the information is collected via the telephone interview questions. As you can see here, social functioning markers are measured in both cohorts with interview questions. And then the cognitive assessment includes a very short version of the Ray auditory learning test, a mental alternation test, and category fluency or animal naming for both the tracking and comprehensive participants. And then for the comprehensive participants, in addition, they receive a Stroop cognitive interference test, letter verbal fluency, and a prospective memory test as well. And this slide just shows biological samples collected that contributes to a large number of biomarkers through hematology and chemistry reporting. And that is also allowed for genomics for about 26,000, epigenetics for just under 1,500, and metabolomics for about 9,500 participants at baseline. And there's more information in terms of genetic variables and availability and so on the CLSA website as well. So as I mentioned, the CLSA also introduces new measures across data collection waves. So in 2002, they began collecting additional information on daily activities using wearable activity trackers to complement the data already being collected about mobility and sleep. Participants who visit the data collection sites in the comprehensive cohorts are invited to use tick watches and actigraphs to monitor activity. These trackers are optional for the comprehensive participants. For those who opt in, The types of things monitored through the activity trackers include step counts, number of stairs climbed, distance traveled, type of travel, car, public transit, walking, cycling, number of minutes active, body position, lying, sitting, standing, and so forth. And participants who consent to these are asked to wear 2 trackers for 7 days, so a tick watch on their wrist and an actigraph tracker on their thigh. The CLSA is also now unrolling use of sleep trackers, specifically a Muse sleep headband that monitors patterns of brain activity while sleeping, and an actigraph tracker for the wrist. And so participants who consent to those measures will wear the headband for 3 nights and wear a wrist actigraph for 7 days. I think I noted quickly earlier that the CLSA also routinely reviews and updates data collection protocols for core measures across the data collection waves. During this process, the scientific domain working groups assess the utility of previously used measures and determine whether it's worth using that measure again, or if it should be discontinued to save participant time, energy, as well as interviewer time, energy. Similarly, they recommend any additional measures for inclusion to the scientific advisory board and the management team. Notably, it's not very easy for new measures to be added, as CLSA participants are already spending a lot of time on the assessments included in the study. So it is rare that substantive changes are made at the different waves. However, that brings us back to the topic of substudies, which have begun to crop up a little bit more recently, where the CLSA team has approved team-based offshoot studies that CLSA participants are approached for participation outside of their regular CLSA visits. So for instance, in response to the COVID-19 pandemic, the CLSA conducted 3 sub-studies to look at impacts of the COVID-19 virus and the pandemic on Canadian older adults. Beginning in April of 2020, more than 28,000 participants, CLSA participants, opted to complete the COVID-19 questionnaire study, which was an 8-month study that examined physical and mental health since just after the beginning of the pandemic, as well as coping and changes associated in how people were accessing healthcare services during that time. The study collected survey data weekly, biweekly, and monthly, kind of depending on the track people were in, both via telephone and web survey. And it included questions on COVID-19 symptoms and status, risk factors, healthcare use, health behaviors, psychosocial and economic consequences of the pandemic. And that data is available for request, and baseline findings are also available for perusal on a study dashboard, which is kind of fun. In the fall of 2020, a COVID-19 seroprevalence study was also launched and collected blood samples in clinic and via dried blood spot analysis from over 19,000 CLSA participants in 10 provinces. As well as an accompanying survey that collected data about symptoms, risk factors, healthcare use, and psychosocial and economic impacts. And then a third sub-study, the COVID-19 brain health study, has the goal of better understanding how COVID-19 affects our cognition in the brain, both immediately and in the longer term. And for that study, eligible participants are completing phone interviews regarding cognition, feelings, and lifestyle, and are also undergoing MRIs at local clinics in association with some of the data collection sites. Aside from the COVID-related sub-studies, there is also the CLSA memory study, which has recently started this past spring. And it's following approximately 600 participants from the 11 CLSA data collection sites who will each complete a short neurological or geriatric assessment, including a MOCA, an informant questionnaire that will be completed about cognitive difficulties, and who will receive a clinical research diagnosis if they have memory difficulties. And then there's the new 6-year Healthy Brain, Healthy Aging initiative, which is funded through the Weston Family Foundation, which is also now underway with the goal of enhancing the CLSA platform with longitudinal brain, MRI, and microbiome data to help examine how these factors correlate with other aging outcomes. So this study will involve 6,000 CLSA participants, and more than 2,500 of those will complete MRI scans to monitor brain structure and function as they age. And these data will also eventually be available for data request. So how do you request data? Because that's an important point. So new data is released as it becomes available. It takes about 6 to 12 months to be released following the completion of a major data collection event, usually. Probably the most important thing to know about data requests is that the CLSA only accepts applications for data that are already available at the time of submission. So you need to know what data are currently available. And to do that, you can consult the CLSA data availability table on the website, which is regularly updated as data becomes available. Applications that are submitted that are proposing use of data that are not yet available at the time of submission are not considered, they're just kicked back. So there's no point in submitting an application unless the data are already available. The CLSA encourages researchers to collaborate on similar research projects. Summaries of approved projects are posted on the approved projects page of the website. It is up to applicants to determine if a similar project has already been approved. It's important to note that all applications submitted to the CLSA are reviewed and considered independently, even if similar research objectives are being proposed by different researchers. The CLSA data are currently available to approved public sector researchers in Canada and elsewhere with no preferential or exclusive access, even for site PIs. Currently, there is no provision to transfer biospecimens to applicants outside of Canada, however, but international researchers can choose to collaborate with a Canadian researcher to access biospecimens if that's of interest, as long as the biospecimens are analyzed within Canada. The primary applicant must hold an eligible appointment, continuing or term appointment at an eligible institution that's able to uphold the conditions of the data access agreement that's required, and administer grant funds and provide research ethics board approval. The CLSA welcomes applications from graduate students and postdocs who wish to use data for their thesis or other research for postdoctoral projects. Another important note is in data access applications, it is expected that applicants provide the level of detail that they would normally provide in a grant application. This is not the case with some other data access applications, and so that doesn't always happen. But if you don't provide adequate detail to assess the feasibility, that will result in rejection of the application. So you want to think about, if you are going to submit an application for CLSA, think about what you would write in a grant application when you're filling out the application form. So here you can just see a timeline for data access. Notably, this is, it's not a data set that you can get data from very quickly, such as say the rush data or something along those lines. There will be a good deal of timeline planning needed to ensure that you can get the data by the time that you'll need it. This is especially true if you're a grad student planning to use CLSA data for your master's or your dissertation work. So you want to make sure that you've got your timelines all figured out for your project so that you can apply at the right timeline well in advance. An important consideration is also the time it will take your institution to complete your data access agreement and ethics approval. So if you can get these things pretty quickly from your institution, then that will decrease the time required. However, this may not be easily done at all institutions. Some may want to carefully review the data transfer agreement with their legal departments, like UVic does, which may require additional time. CLSA estimates that this part takes about 12 weeks, but really it all depends on your institution, and sometimes it might just depend on how busy they are at that moment. And that's completely outside of CLSA's control. So those 12 weeks are really between you and your institution. Overall, the anticipated time frame, though, taking that time into account, is about 6 months. And that includes the application review process, agreement negotiation between CLSA and the institution, time to obtain ethics approval from your institution research ethics board, and data set preparation and release to you from CLSA. In terms of timing, these are the updated timelines for this year. CLSA does use a set application deadline versus a rolling submissions that some other data sets use. All applications need to be received by 5 p.m. Eastern time on the submission deadline. The application should include, if available, a copy of the letter or the certification for ethics, as well as any funding. However, ethics approval is not required at the time of the application. It is required for data to be released, though. And project-based funding is also not specifically required, but it should definitely be indicated in the proposal or in the application if possible, if you have got it, because that'll signal to the people reviewing it as the part of the data access committee, that the project has already undergone a peer review, which will assist with their scientific review for feasibility of the application. So if you have funding for that project, definitely include the information about that funding, because that will help in the process for review. Yeah, you can follow the progress of your application through the online application system, and you'll be contacted once the process is complete. Or you may be contacted sooner if they require additional information from you. They do have kind of a minor revision, major revision / rejection kind of criteria. And so if it's only deemed to need minor revisions, they may contact you partway through the process. Yeah. In terms of the data access steps, the first thing that you'll need to do is to create a profile for a website that is called Magnolia, which is CLSA's online data access application system. To do that, you'll need to email access@clsa-elcv.ca, which is their website for requesting information or requesting access. You will need an institutional email. You'll need to provide your position title and which institution is part of the request or will be handling the data access agreement. As a note, students will also need to have this account access to complete their applications, but their supervisors will also need to have an account to submit the application. So generally, supervisors can request both accounts via email, although a student could request an account independently as well. Once an application is submitted, the Data and Sample Access Committee reviews applications and makes recommendations to the CLSA Scientific Management Team. Once the Scientific Management Team has approved a project, then CLSA requires a data access agreement and proof of ethics. And after those steps are complete, the dataset links are sent out. Dataset links are only valid for 7 days, and the number of downloads is determined by the number of people on your team who are meant to have access to data. It's also notable that researchers who have received data with a specified time period within which the proposed analyses need to be completed, which the application does require you indicate a timeline. Then basically, if analyses are not completed in the given time frame, the applicant needs to submit an amendment request for a time extension, or their data access agreement could be terminated. So that's important to note and just to keep track of as you're working through. In terms of data fees, the CLSA does charge researchers using a partial cost recovery model. So the fees incorporate partial recovery of administrative costs, data processing, data retrieval, and delivery costs incurred by the CLSA as part of the data and biospecimen access process. The charge for an approved application is 3,000 Canadian dollars for researchers in Canada and 5,000 Canadian dollars for researchers outside of Canada. Additional fees do apply for access to image files, raw data, data sets that require more complex customization. Some of these are listed in the table on the slide, and others are on a case-by-case basis. There are also fee waivers available for graduate students, though. So master's or PhD students at Canadian institutions who wish to use CLSA data for their theses specifically are able to get a fee waiver. Postdoctoral fellows can also get one fee waiver per fellow if they wish to use CLSA data for the sole purpose of their postdoctoral project. And then Canadian trainees who are working outside of Canada but who are funded by a Canadian source are also eligible for these fee waivers. To request a fee waiver, it has to be done at the time of the data access application. So that's an important point to make sure that is done if you're hoping to get a fee waiver. Yeah, and then just in terms of challenges, you can't apply for CLSA data access without an institutional email address. In terms of managing that, collaboration with somebody at an institution who is able to be the primary applicant can assist with that requirement. In terms of application fees, that may be a barrier. I think, I mean, as an ECR, I find that that's especially a barrier for people in my situation as an early career researcher. But it is what it is, and you can get fee waivers for your graduate students to do their projects, which is helpful. I know that's something that my students have used in the past. Aside from these, a main issue that arises for those that are interested in use of data is the timeline required to gain access. And this is a data set that you really do need to plan to use in advance. It's not one that you can just look up online and then be using in a week or two, which is the case with some other data sets. There is no way to get data access without a review process for CLSA, even for PIs. So that's just something to keep in mind. For more information about the CLSA, I strongly encourage anyone interested to check out the website. It has a ton of information on it. It's updated relatively frequently. It's got an enormous amount of detail for information relevant to researchers, including protocols that are used in the study, details of projects that have received approval for data access. You can look at the researcher section of the website. You can find data support documentation for all sorts of things, including variables that have been defined after data collection, genomics, all of that stuff is on there. The data access section of the site will provide specific detailed instructions on how to complete the access application and deadlines for the competitions, or that's not really competition, for completion and submission of those. And then in the Stay Informed section of the site, you can find details about how to be added to the CLSA webinars listserv if you're interested in that KT piece, as well as a bunch of other videos and interesting KT resources and stuff like that as well. So yeah, that's about it. Thank you for your time. I hope it's been at least a bit informative in terms of acknowledgements. Most of the information in this presentation is care of the CLSA website. So please take a look there. And then I also would just like to thank my RAs, Emma and Mickey, who tried to make this pretty for me as well. Thank you. Any questions?